In this video, I'm going to differentiate between the resting, intention, and the essential tremors. So resting tremor is a type of tremor where the tremor is present at rest, but it disappears with volunteer activity. So for instance, once the patient tries to grab onto an object, the tremor goes away. And this type of tremor is commonly seen in patients with Parkinson's disease due to damage to the basal ganglia. And for the treatment of this tremor, you can give the antimuscarinic drugs like, for instance, benztropine. Next, we have intention tremor, where the patient doesn't have tremor at rest, but then they develop tremor at the end of purposeful movement. So for instance, once they're trying to grab onto an object, then that's the time they develop their tremor. And this tremor is seen in patients with multiple sclerosis or in chronic alcoholism due to the damage to the cerebellum. And thus, for the same reason, the other name for intention tremor is the cerebellar tremor. Now, because there is damage to the cerebellum in these patients, sometimes nystagmus and dysarthria may also be present at the same time with intention tremor. And then for the treatment of these patients, you can give the same medication, which is benztropine. And then finally, we have essential tremor, which can present with both the resting and intention tremor, but is associated with less of the resting tremor and more of the intention tremor. And this is an autosomal dominant disorder, which needs to be treated with the propranolol, which is a beta blocker, as well as the primidone. And that concludes our discussion.